from the American Academy of Pediatrics.
After feeding and sleep, thinking about our kids pooping takes so much of our brain power in the early years. What's normal? Should I be worried? Today, we have answers.
There's not just the consistency, not just the color, not just the frequency, but it's all these things contribute to whether we're having healthy poop, healthy bowel movements.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bradshaw Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today we're talking about poop, a topic I'm very familiar with as a pediatrician, but to be honest, it wasn't until I became a mom that I realized how much of your time goes to thinking about poop when you have a kid. We have a great guest today to help us answer the questions we all have had, or will have at some point about our kids' poop. Joining me today is Dr. Nathan Chomilo. He is a general pediatrician and AAP spokesperson and a dad of two little boys. Welcome, Nathan.
Thank you, Edith. So glad to be here to talk about poop.
Yay! The conversation we all want to have. Nathan, let's start with a little context, and we may need to talk about it by age because this really varies, as you know, as a pediatrician and dad. But how much pooping is enough/normal pooping?
Yeah, I always talk to parents about there being a wide spectrum, right? Healthy looks different for every kid. It looks different for kids in your own family, right? And so when you think about like just from the get, from the very first time you get to meet your bundle of joy, some kids in those first couple of weeks are pooping after every feed. Right? There's a reflex I talk to parents about, a gastrocolic reflex, where once something hits the stomach, your colon starts squeezing, and that is more pronounced in some kiddos than others. And so you will see some kiddos who are pooping, and parents are wondering, is this too much? But then we also know that there's some kids in those first couple of weeks who only poop once a day, sometimes even every other day at the beginning, and that can be normal too. We kind of talk about what are other things to be looking at when we talk about poop and not just how frequent it is.
Yeah. Talk to me, Nathan, about what happens and what you see when kids start to get a little bit older. So we're talking now closer to a year into the toddler ages. We know that in the initial newborn period and infancy, highly variable, all very frequently spectrums of normal. But what happens as kids get a little bit older?
Yeah, so as they get a little bit older, diets change for one. So we're moving from kind of a liquid diet of breast milk or formula to a much more varied diet. And with that, folks have different kind of reactions to how they digest and process things. We know that folks and children who are able to eat more fruits and vegetables usually have a little more regular stooling patterns, and that can look like having a stool every day. And then we know that when diets change, or if folks don't have as much, high fiber foods, if they aren't drinking enough water, then they can start to get more backed up, and that can then stretch out to, look anywhere from, every other day to, once a week, even some patterns that do evolve. And so again, frequency is one part of it. Then we usually move to kind of talking about, well, what is the consistency of the stool? Do we have pain when we are passing stool or concerns for pain? Are we seeing other concerning signs or reassuring signs of how, our stooling is going?
Yeah, totally. And it's such a journey, right? Because at the same time, you're introducing different foods, right? You're learning to drink water. And then kids are getting into different routines for everything, for eating, for sleeping, for going to the bathroom. I mean, there's such a journey here. And as you mentioned, really, the frequency is just one aspect of things. Now, I definitely want to talk to you about not enough pooping, right? Like when that frequency starts to become problematic and other patterns that we find problematic, aka constipation. But just so we fully establish our normal, and I want to ask you this because it's a question that I get from so many parents. I wonder if it's also the case for you, but what's a normal poop color, Nathan?
Yeah, that is a very common one, particularly in the earlier years, where again you are introducing new foods. If moms or birthing persons are, breastfeeding, their own diet changes can actually then change some of the color and appearance of stools. And so I use the kind of reference of earth tones, right? And so anything that is kind of brown, tan, green, yellow, these are all normal colors of stool. And then like colors of stool that make me concerned are if it's like white, like an egg, if it is black, and then obviously red or concerns for blood would be ones. And then I think another thing to think about too that I often will ask parents about if they're concerned about the color of the stool is, are they on any recent medications? Because there's certain medications that we do know change the color of our stool. Most commonly is an antibiotic that's used for ear infections that can turn your stool to look like orange. And so it's not uncommon every year to get a call from the on-call line in our practice where, a child's stool over in the middle of the night after starting that antibiotic looks orange and a parent is freaking out appropriately. And we just try to kind of, reassure them that is related to the medication. But that's another thing to kind of consider when you're looking at the color.
Yeah. And the other one in my experience is iron, which can turn your stool a little dark. And it's true for little babies. It's true also for grownups. Iron can definitely turn your stool dark. And we need to, give parents a little heads up that this is going to happen so they don't call us in the middle of the night.
Yes. I often say, if I forgot, that one's on me. I'm sorry. We should have given you that heads up.
Right. And it's, it's funny that we're sort of talking about poop color in a very lighthearted way. And, I had a mom once get a little bit frustrated. She said to me, "It's all normal, doctora." Remember, my patients are all, and I've talked about it in the show, are mostly Dominican. And so, this mom was like, "Everything I bring to you, you say, it's normal, doctora. What's going on here?" But it really is, right, Nathan? I mean, the browns, the greens, the yellows, they really are normal, right?
Yes. And that's some of our job, is to provide that reassurance, understand where the concern could be, particularly when, maybe it's your first time taking care of a newborn, or looking at another person's poop on a daily basis, and you kind of notice these changes in ways that you don't know yourself. I think one other thing that makes me think of when it comes to poop is a lot of concerns about discomfort in babies as they poop. And I really remember this one lecture I went to on an expert in GI and in poop. He was talking about if you put a mirror up to your face while you pooped, you actually might see yourself grimacing a little bit or, scrunching your face up. And so trying not to overinterpret, discomfort based off of how our, little ones who can't use all their words yet are experiencing their pooping. And I think that, translates to color as well.
Yeah, no, totally. And they don't have the help of gravity, right? If they're not really sitting up yet. And they also don't have the abdominal muscle strength to help them out. So this can be a little hard for them. So totally. But when you're a new mom and you're seeing your baby struggle, that's a whole, I know all of this as a pediatrician. And then when I saw my little guy struggle, I was just like, how do I help you? How do I help you? Not easy.
And it takes a while too to what those signals are and pick up and as we talked about a bit earlier, it is an evolving thing too. So you kind of know how it is in one stage, and then diets change, and you got to kind of learn those signals and cues again all over.
Totally. And now because we do want to learn those signals, those cues, and we want to know normal from not normal, and I actually should freak out or worry or do something, right? Let's talk about constipation, Nathan, because it is so incredibly common. And yet, in my experience, a lot of us in our busy, crazy lives can miss some of the symptoms, especially when they're early or mild, especially when we've gotten a little bit comfortable with the grimacing and the stools changing in color and changing in consistency. So I wonder if you can walk us through what constipation looks like. And again, maybe we can break it up by age. So what does an infant who's constipated look like? What about a toddler and later on in the school age years?
Yeah, so for infants, it is a little hard at first, pardon the pun, to understand if it's truly constipation. if you're just looking at their behavior. And so it is looking more at the stool consistency. It should, for most infants be pretty loose, and then kind of a transition into kind of a seedier type consistency and then to a paste. And if you start seeing, I talk about like little rabbit-sized balls of poop that all right from the start look like the, constipation you might experience, which is kind of really hard, big poops. So those kind of hard balls of poop.
Pellets.
Like pellets, exactly, is kind of a sign of constipation in our infants. As they get into, toddlers, and sometimes you can see as infants too, you do start to see then those more bigger, firm stools. Certainly in infants, you can see some bleeding if it's really hard to pass, right? You can start to see some irritation as it comes out of the rectum, then causes some discomfort, crying, those type of things. And then if you think about it, if you are getting backed up, that can actually impact your appetite and your ability to eat. And so sometimes in infants, you can see decreased interest in eating or even spit up increase if you're really backed up. And so those would be some of the other signs to kind of think about if you're worried about constipation to bring up with your pediatrician. And those would be the ones that I would be, concerned. And then we would think about moving towards, more treatments or other things like that.
Yeah. Before we move on to, what causes constipation, which in my mind, it's like always what I'm thinking about as a pediatrician and what I'm trying to prevent as a mom in my own home. But in terms of the frequency, Nathan, because I think parents really, really care about the frequency. As kids get older, we back off a little bit, but we do worry about frequency. I do as a mom, definitely. So in the early months, what's a frequency that would concern you?
Yeah, so it somewhat depends on if they're getting breastfed or formula. We do know that kiddos that are formula fed are a little more likely to have longer gaps in between stooling. And so if I have a breastfed kiddo and they are pooping every 3 or 4 days, I'm going to be a little more concerned, particularly if I'm seeing some of these other symptoms. For formula-fed kiddos, the norm can be up to a week, if we're not seeing any other concerns of really bad constipation. But that week is probably like an easy across the board threshold. And even for some patients, I will talk about, 4 to 5 days. That, that's when you should really start paying attention, right? And then if you haven't seen anything by like a week, then, bringing them in or giving a call to your, nurse hotline or your provider's on-call line to talk about next steps.
Yeah, I love that as a guideline because I have to tell you, I get a lot of phone calls from 2 days of not pooping, yes. Which as a first-time mom, I understand. But hopefully we can save you some worrying at home just by discussing this a little bit. And again, what are the other symptoms? And always, of course, discussing with your pediatrician. Now, Nathan, what about toddlers? I have a 2-year-old. How many days can he go without pooping before I got to worry?
Yeah, that one, you can get a little closer to a week. Again, it depends on what has been their normal stooling. And if it's all of a sudden they're, a regular stooler every day, and then all of a sudden there's a week, and then again, you're seeing these other symptoms, you want to maybe call day 4 or 5. But, if they have kind of been a consistent, 3-4 days through infancy, as you move into toddlerdom, it can be normal to have a little bit longer of a time. And again, up to a week can be normal, but I wouldn't wait longer than that even for toddlers or, for older kids either.
Yeah. I have to tell you, as a pediatrician, I'm very aggressive about getting kids pooping, especially toddlers. And the reason I'm aggressive about getting toddlers pooping is because they're usually eating. And so there are things that we can do that aren't medications necessarily, although we use medications when we need to. But because I know that I can help manage this and get kids pooping with diet, I'm sort of more aggressive about helping them get to a more regular schedule. And maybe aggressive is not the right word. Maybe proactive would be a better word to talk about it. But, at that point, I know that I can do something about it with nutrition and good stuff in the diet, right? But in your experience, Nathan, what are the most common reasons that kids get constipated? And we're talking more the toddlers and school age kids, because at that point we know that, there's diet, there's other things. So What are the most common offenders in your practice?
Yeah, for toddlers and then school age kids and even adults. I'm a med peds doc, so I'm trained to take care of adults. It really is diet, and when we look at diet, it's are we taking in fiber and are we drinking enough fluid? And I think when you look at a lot of what's been described as toddler diets, common diet might include a lot of kind of fried foods like French fries and chicken nuggets. It might include a lot of cereals, right? Grains. But not as much fruits and vegetables. And then the fluids that they drink, often there's a decent amount of water, but it might be more milk or a lot more milk. And so those things all can kind of contribute, particularly if it's the milk with more vitamin D and iron, to constipation. And so then thinking about how do we, to your point, be more proactive and really try to kind of set the expectation of certain numbers of fruits or vegetables. How do we monitor more what we're giving as far as fluid and work from those places first?
Totally. And I have to tell you, in my practice, it's very often excess milk, as well as that very normal and perhaps from an evolutionary perspective, advantageous preference that toddlers have for that bread, the pasta, and the rice. I mean, it's just across the board. That's their preference, right? That's what they tend to go to or gravitate towards to. So definitely the types of fluids, how much fluid and the diet, definitely, and how much fiber they're consuming. And Nathan, in my experience, and you tell me if you have also seen this, but in my experience, nutritionists, dietitians, even other clinicians are sometimes quick to blame cultural foods such as rice and plantains. Again, I work in a primarily Hispanic part of New York City for constipation. So I would honestly never tell a Dominican family, for example, to stop eating arroz or tostones, right? In my experience, everyone is happier and children poop when instead of saying to a family, stop eating this, which they love eating and is part of their culture, we say, add fiber and here's how you can do it. So my question to you is, how do you approach honoring family dynamics, including culture? And what are sort of your favorite go-tos when it comes to things to add to the diet?
Yeah, and so my family is from West Africa, and a lot of my practice actually is a lot of West African immigrants. And so along with the rice, we also have things like fufu, which is like a grain-based paste, porridge, which is really a kind of a type of oatmeal that are really common at this age. And so I completely agree, right? Like it can't just be stop this or take this out when that's the staple. Particularly when you think of toddlers, we want them to be eating kind of the same thing that the rest of the family is eating. You want to kind of get that to be kind of just part of it. You don't want mom or dad, you're making like 4 different meals for each kid based off of their age and stage. So I usually actually, draw a circle and say, when you look at a plate that you're making for yourself or for your child, kind of draw a line down the middle of that circle and try to have like fruits and vegetables on that half of the plate. And then you draw another line across the other side of the circle. So you kind of have a half and then 2 quarters, and then 1/4 is your meats or your protein, and then 1/4 is your grains, right? And try to kind of better right size, because I, say usually, and it's typical that the whole plate is all rice or all noodles or, all grains. So how do we kind of better shift that? And then when as far as kind of go-to fruits or vegetables, I usually like asking both, parents for young kids, and then once kids are starting to able to answer for themselves, what's your favorite fruit or vegetable? And then you talk about, my favorite, vegetable is carrots, is often one. Fruit is like, apple, banana. And we talk about like what a serving is. So 1 serving of carrots is a cup. And it's like you say, if mom or dad, makes a cup with their hands, fills that with carrots, that's 1 serving. If it's 1 apple, if it's 1 banana, that's 1 serving. And so trying to mix, 5 of those in throughout the day is one goal you can make. If you're not doing 5 now, don't set the goal for 5 tomorrow. Let's say add one more, tomorrow, and for the next week, just add one more. And then the following week, you can add additional one and move your way up until getting towards 5 more consistently. And I found, both kind of breaking it down that way, giving folks kind of more achievable goals, does feel like folks are more responsive to that and see like how they can start incorporating it into what they're doing without it being this big change that everybody notices, creates conflicts and fights at the dinner table, which we also want to avoid, and then gets, folks poop right.
Yeah. And I love that you're bringing the child into that education that you're doing and that discussion that you're having with families, because so often we tell the parents, go do this, right? And we don't really bring the kids in. And then when they go do it, huge clash in the home, right? So definitely bringing the kids in. I'll tell you, my other favorite ones are pears, like all the like pea things, the pears, the papaya, the prunes. So I always sort of try to nudge a little bit, like when you're going to the store, try to get some of those things and try to bring your kid so they're involved from the beginning. Nathan, and finally, we like to close out our episodes with what we call a parenting prescription. What is one thing that you want all our listeners to know?
So what's one thing for parents to take away? Well, I think having an idea that poop is multifactorial, right? There's not just the consistency, not just the color, not just the frequency or how often, but it's all these things contribute to whether we're having healthy poop, healthy bowel movements. And so when you're concerned, certainly call the pediatrician, but certain time frames, certain things could make you more concerned. If we haven't had a poop in 5 days, if we have poop that is bloody, if it's dark black or white like an egg, call your pediatrician. And if you think that the poop is, really causing pain, discomfort, or decreased eating, certainly reach out to your pediatrician. But hopefully now you have some understanding of what is normal, the wide spectrum of normal, and that every kiddo's poop is going to be a little different, and that's okay.
Yeah, Dr. Nathan Chomilo bringing nuance to our poop conversations and giving us concrete things to look out for. Thank you so much for joining us today.
Thanks so much for having me, Edith.
And thank you at home for joining us today. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Ann Johnsos,
Doug Nagel,
Susan Stevens-Martin,
Laura Alessio,
Jackie Ortega,
Mary Claire Walsh,
Hannah Weston,
Kathy Jewell,
Catherine Beard,
and Garrett Brown.
Our theme music was composed by Doug Nagel. This episode wraps up our first season, but we'll be back in a few weeks with season 2. We're planning a special Ask the Pediatrician episode with Healthy Children medical editor Dr. Jennifer Shu. And we want your questions. So go to healthychildren.org/podcast and click on the survey. We cannot wait to hear from you. Until then, I'm Dr. Edith Bracho Sanchez. Thanks for listening.